Hi everyone, it's Kyra in the ED. I'm an emergency room physician assistant. So I wanted to tell you about a time where there was a medical emergency on a plane I was on. So I was traveling back from Florida with my husband. We were on vacation. It was all lovely. I had my audiobook in. And then I hear, any medical providers, please come to the front of the plane. There is a passenger in distress. And I lock eyes with my husband because he knows that this is a nightmare of mine, of a medical emergency on a plane. And I'm like, please let there be a doctor on here. But I get up and I go to the front of the plane. There's actually quite a few medical personnel there. So I was the highest trained provider there. So everyone else sits down. The patient is a young woman experiencing symptoms of a stroke, right? And that's really not normal for a young, healthy person to have. She had weakness on half her body, slurring of speech, facial droop, her eyelid wasn't moving properly. And so we were all really concerned. The flight attendants actually pull out this big bag that has quite a few medical supplies, not like a typical first aid kit. It was like fluids, IVs, quite impressive, and like stuff for ACLS, which is like when someone doesn't have a heartbeat and you're doing chest compressions. Dr. Mike, I'm looking at you.
Again, chest compression, chest compression, chest compression.
The patient's symptoms started to improve while we were in the air, but prior to that, I had asked the flight attendant, what are our options here? I've never ever treated anyone in the air. And she said, we can keep flying, we can divert to the nearest hospital. And she was like, do you think the person needs to be diverted? And I go, no, she needs hospital, she needs to be diverted. So they let the pilot know that I want to divert the plane, which I did not have any clue that I had any authority to make that call or do that. And they divert the plane to the nearest available airport and contact emergency providers en route to let them know that we're going to be landing with an acute patient that needs to be seen at a hospital, so that they'll be waiting at the airport when we land. And like I said, the patient's symptoms started to improve. So I suspect it could have been something called a transient ischemic attack, which is essentially a mini stroke. Luckily, I got her mom's phone number and she was evaluated at the hospital and was doing well. Definitely one of the most wild ways to end my vacation. Alrighty guys, see you later. Remember, we're always here to help you.